you know, information and stuff? I don't know. I don't know.
If someone had lead clots in their lungs.
There you go.
Okay, good.
I didn't even think about that, but that makes sense to me. So, okay. Okay, so as far as spirometers are concerned, there's basically two types. There's volume and there's flow. And if you go online and look at all the different spirometers that are out there that are available, there's so much out there. And there's big ones, little ones. I've seen machines with tubes on them and this and that. And the only one that we use is this one right here, because it's portable, it's small, and it does a good job. It actually does a fine job. And this is a flow type meter that we have here, which is it's an ultrasound type process that uses. Let me. I'm going to start passing some stuff around here. So this is a tube that is used in this machine here, and this is a mouthpiece here, okay, and this mouthpiece requires that the person take their mouth and get it over it like this, not be pushing up against it like that. And if you look at the tube itself, most of the science in this thing is in this tube, because this is a precise hole that's in here, okay? It may not, even though it's plastic, it doesn't look like it's much. It's actually a precise instrument in itself, because the air that flows through this can be measured very accurately because of the way this hole is produced here. And if you look at the side of the tube here, there's two ports. And these ports is what allows the ultrasound device to work. I'll go ahead and pass that through and we'll continue talking about it. So here's the tube right here, and the person's mouth is over on this end here, okay, and blowing that way. And you have a what they call a transducer here, that red block there, and a transducer on the other side. And the transducer sends and receives signals. That's all it does. And as the air flows across here, this transducer is sending and receiving signals, and it can actually, it says a Doppler effect, I guess, I call it Doppler. But ultrasound actually goes with sound waves. And even when you breathe, you may not think that you're making a sound breathing, but you are. And the sound wave that's being produced that's coming across here, when it hits the first transducer receiver, it picks that up. And then when it gets to this point, it picks it up again. So it measures the speed of that particular sound wave from this point to this point. And that's how you can get that flow in seconds. Does that make sense to everyone? Is that too technical? Because it is for me. But like I said, this dimension here, this diameter on that tube is precise. And that's why they can get good exact measurements on this thing, because it is so precise. And of course, this is a plug for Easy One. This is what we use here. And not everyone in this room likes it. I actually like the machine. I get along fine with it. So it is easy for me to use. Mary and I were talking about it earlier tonight, and they use it at their clinic too. Her criticism on it is that when inputting the information, you can't back out of it. If you make a mistake inputting, then you have to stop, turn it off, and redo everything. You know. So, and I had to agree with her. She was right. You know. But I do like it, and it does give us good results if you perform the test properly. Okay. And I better get moving on here. So this is a test procedure. This is the information we collect when we're doing the test. You've got to have it. And you have to get a blood pressure check. before doing the testing. If a person has any cardiac problems, high blood pressure, that sort of thing, you don't want to perform this test because you're stressing that person whenever you're doing this test. And you don't want to stress them to the point where they're going to have a heart attack on you. I've never had anyone have a heart attack on me when doing this test, but I can remember vividly one person who actually passed out on me. I can remember one person who went into convulsions and started foaming at the mouth. And I can remember one third person who was not accustomed to breathing to any sort of exertion. This guy had a very lax lifestyle. I think he just laid in bed all day or something. But when we did the test on him, his muscles around the lung area cramped up on him and he couldn't do anything. He just froze up. So that was a little scary. So now, this is reasons why we would not perform a test. If they've had surgeries in the past 6 weeks, we don't want them splitting their stitches. If they've had a heart attack, any respiratory infections, that sort of thing.
Heart attack within how long?
6 weeks. Now, and this one here is if they have an aneurysm or hemoptysis. I didn't even know what that word was until I looked it up. And what it is they have a problem with coughing blood. Okay. And if they are coughing, and I'm not talking about bleeding gums, I mean coughing up blood. If they're doing that, no. If they had an inhaler where they've been using it in the last 6 hours, we won't get good results. And again, the blood pressure check we want to do. And if they smoked a cigarette in the last hour, technically speaking, you're not supposed to do the test. Or if they've had a heavy meal within the last hour.
Or a big thing is caffeine intake.
Oh yeah. That's right. I don't know why that wasn't on there. Yeah, caffeine is a natural vasoconstrictor, if you didn't know that. And so when you drink a lot of caffeine, your lungs are not working as well as they could be because of it being a vasoconstrictor. And it also, being a vasoconstrictor, causes your blood pressure to go up as well.
In asthmatic patients, it would actually work the opposite. It would open up the bronchitis. Therefore, you wouldn't see if you had a problem because the caffeine opens you up. So if somebody has like major asthma and you have nothing, best thing you can give them is a cup of black straight coffee.
Yeah. You know what else good black straight coffee is good for too? Is if you are under a migraine attack.
Mm-hmm.
You don't drink coffee. If you're prone to migraines, you don't drink coffee. But if you're in the middle of an attack, you drink coffee. Because it reduces the vessels and helps that brain deal with that. Okay, and I'm going to pass around our pre-screening questions that we use at our clinic. You can just kind of get an idea of what we do. So we also get a respiratory history, and this is a questionnaire. This is an OSHA standard questionnaire that we use. These questions are the same questions everybody else uses. There's no difference. And basically what we're doing is we're screening patients to see whether or not they are a candidate to have a PFT test. And we're also screening patients to see if there's some serious disorders that they need to address before we continue to let them work in the occupation they want to. All right, so to do a good test, we have to ask the pre-screening questions that are being passed around. We have to get a height and a blood pressure, a weight. We have to make sure we explain the procedure, make sure they have proper posture. I can't emphasize how much explaining the procedure to the patient is. In order to get a good result, you have to really, really make sure they understand what you're wanting. Because what you're trying to get from this patient is maximum effort and consistency. Okay? And if you don't get it, you know, we have to get at least 3 trials on the test, 2 of which have to be within a certain amount of each other for it to be a valid test.
150 mLs or something.
Exactly, 150 mLs difference between the 2 tests. And some people just don't quite grasp the concept of how to put out that effort, and they'll do 1, 2, 3, and you're still not getting it. It's 4 or 5, and we can't do it more than 8 times. 8 is the maximum limit. And most guys, they get up to 5 or 6 times, they're going, no. Let me get through. I can't do it, because it makes them work. They're doing something they're not accustomed to doing. So, and then part of the 6 steps is demonstrating how you want to do this test, and just explaining all these steps out, and then following the protocol.
How often do you do that test, Dave, on a regular? You?
Me personally,
Yes.
in a day it could be sometimes nothing, and some days I may do 5 or 6. Last Friday I did 34 of them. I did an on-site and did 34 of these
In one day?
in one day. So there was 3 of us. We had a person who was doing the vitals and taking all the information. I was doing the PFTs, and then we had a provider who was reviewing the results with the patient. So we're kind of assembly line. We got through 34. Actually, there was more than 34. We had 45 patients we had to get through in one day, 11 of which we did not have to do PFTs, and 34 we did. And the main reasons, well, 2/3 of the reasons why they had to do PFTs was because smoking habit. Smoking. And about 1/3 of the reason is because they had some sort of cardiac problem, and we had to check and then double check, make sure they were good on that. And then we had one person who had chronic pneumonia. This person would get pneumonia. This person was 26 years old, and in his lifetime he had pneumonia like 12, 13 times in his lifetime. I mean, he was a preemie too. And and he used to smoke. He did quit smoking, but he was a smoker. So, okay. So this is what our goals are. We're trying to get 3 acceptable tests that are repeatable. And repeatability means that the 2 highest FVCs are compared, and they must be within 150 mLs of each other. And we're also comparing the 2 highest FEV1s, and they also must be within 150 mLs of each other. Okay. Now, that sounds like a lot of work, but the machine does it. It's got a little computer chip in there, and it knows. So all you do is take the test, and it gives you the results. And again, you can perform up to 8 maneuvers on this. But I tell you, if you go 8 times with a guy, when he catches his breath, he may get up and just hit you. They do not like this test. When we do exams, this is the worst part of the exam that they really hate.
So looking at these pre-screening questions, the first 4 say do not proceed.
Right.
But what about if they answer yes? I mean, a lot of people are under a physician's care for high blood pressure.
Yeah. The first 4, if they answer yes to any of those, we stop right there, and I'll go to the provider. What I'll do is I'll get an explanation from the patient as to what's going on with that. And then I'll take that information, go to the provider and say, this is Joe. Joe's got this going on in his life, and yada, yada, yada. he wants to go ahead and do this test or not. And the provider makes the final say. Okay? And in generally most cases, it's not serious enough that we would start the test. But we had a few people. Most instances where we will not do the test is if that BP is over the 150 or 100 on that. That is our in-house standard operating procedure. Okay. And
So I'm looking at these, and the pulmonologist in town
yeah.
has ordered breathing tests. And I can say that the patient, because it's my dad, is being treated for high blood pressure,
Yeah.
may have smoked without whining,
Yeah.
has respiratory infection,
Yeah. Okay.
probably used his inhalers in the morning,
Quite often, yeah.
had 1 or 2 cups of coffee, and sometimes is wearing his dentures.
So when it comes to like the denture question, one of the questions I always ask in addition to the denture question is, do you have gum in your mouth? Well, seriously, because I did one test, a guy had gum in his mouth, I didn't realize it, and he was trying to blow, and I'm going, God, something's not right here. I couldn't figure it out at first, and it took like 2 blows before I finally figured it out. And I said, you got something in your mouth? And he said, oh yeah. So I always ask them if they have gum or chew, because, you know, we're a bunch of guys in the occupational health clinic, and you want to get that stuff out of there. And besides not getting a good test because of that being in the mouth, there's also the risk that they might choke. Now that sort of thing. And the thing with the dentures mostly, and Melissa, correct me if I'm wrong, is nowadays dentures fit a lot better than they used to, but in olden days they were a little clickety-clackety, you know. And if you got a full set, that's probably not a problem. But if it's a small add-on kind of thing, there is a risk that they might take in a breath and suck in their denture. Okay, and you don't want that happening. So that, yeah, partials, that sort of thing. So that's part of the reason why we ask these questions. Okay, so now I need a volunteer. Who want? Let's do a non-smoker, okay? So, any volunteers? We're going to actually do one here.
I'll do it.
Go get him.
You want to do it?
Well, I don't want to do it, but
Alright.
you need a volunteer.
All right, jack it off because I got to get blood pressure. And we're going to go on the honor system then. So, write down what your height and weight here is, okay?
It is really important the patient understands.
We usually do our blood pressures on the left arm. And the reason we like to use the left arm is closer to the heart, and we think that the blood pressure reading is a little more accurate on the left arm. In most instances, not always.
Oh, thanks, Anthony. Want to make my blood pressure really high?
Okay. You're going to have to, you know, blur out the reading on the cuff there because we don't want it to divulge.
First one is to get a whole idea.
Right, that's the learning, and then there's a curve, and then there's the test.
Yes.
I think that's actually.
Without him saying he has to go into this manually.
Which line that?
What was it?
Yeah, blur it out for
Yeah.
what?
All right. You need date of birth. Okay, Ben. Have you had a chest injury in the last 6 weeks?
No.
In the last 6 weeks, have you had surgery involving your chest, eyes, ears, or abdomen?
No.
In the last 6 weeks, have you been hospitalized with a heart attack?
No.
Have you had any recent chest pain?
No.
You do not have.
Are you under physician's care for high blood pressure?
No.
When was the last time you smoked a cigarette?
Never.
All right. Within the last hour, have you eaten a full meal?
No.
Okay. Have you had a respiratory infection such as the flu, pneumonia, bronchitis, or chest cold in the last 3 weeks?
No.
Okay, now on that question there, we're concerned about what's going on here. If it's sinus, it doesn't matter. Okay? If they got sinus congestion, we don't care about that. Have you used an inhaled bronchodilator such as Primatene Mist or Ventolin in the last 6 hours?
No.
Have you had more than 2 cups of caffeinated beverage in the last 6 hours?
No.
Are you wearing restricted clothing? Dentures? No. All right. And no gum, right?
No.
So we have gone through our pre-screening questions, and he is a candidate. We're not going to be worried about choking and dying from a heart attack or something. So now, this tube here is in a plastic bag. See how that is? When we open this plastic bag up, now, Melissa's probably going to correct me on this, but I don't like to have them open the bag up and do this because I usually end up having to put it in the machine myself anyway.
Keep the end on.
But what I do, well, there's a little arrow thing here, and for some reason, some patients just can't put a square block into a square hole. They want to do this or that. So I usually do it for them. So I open it up like this. It's got a little tear thing, but I keep the bag on the mouthpiece so I'm not touching what they're putting their mouth on, okay? And then I'll go ahead and I'll put this in here like this because it snaps in there. For some reason, because they're not accustomed to it, and I understand that. So I like to do it for them. I think in the training class they say to let them do it. Isn't that what they say?
I always did it that way.
Okay, all right.
We do it that way too.
Okay, yeah, and I think it makes better sense to do it. Okay, so I'm turning the machine on, and it's on, and we're going to program it based on his particular results. So, new ID 1, 2, 3, 4, name is, and how old is the baby?
23.
That was very discreet, but he doesn't have to worry. It's those of us back here that have to worry about it. What do you weigh?
Are you lying to me about that weight? No. I think you are.
Don't mess up, you're gonna start all over.
Okay. You're not a smoker, right? Are you a former smoker?
No.
Okay. Any history of asthma? No. Okay. All right, so this is how it works, Ben. I'm going to push a button on the machine here. I'm going to hand it over to you like this,
Yeah.
and you're going to grab it like a hamburger and hold it up here like this. Don't hold it down here, hold it up here. All right. Now, after you get a hold of it, you're going to take a deep breath. When I say deep breath, what you're doing is you are filling your lungs to their absolute fullest capacity. That's important. You got to do that. It's critical.
When the University of Washington came out and set us up for this spirometry, they told us the patient had to stand up.
Okay, that is true. There's in the literature that I have, certain patients are required to stand up because if they're obese, for one. In our operating system that we have, we make them sit down, and for a couple of reasons. Because quite often when they're doing this test, they actually get dizzy.
Well, we have a chair next to them, but they're stand up with their back against the bed so they don't.
Where I do this at, I have a corner, and they're sitting in the corner facing me. And that way, if they start going like this, all I have to do is put a hand on the shoulder and help keep them steady. Okay? But we do all our testing sitting down at our clinic, unless there's a physiological reason why they should be standing, an obese person, or if the company that's requesting the PFT test to be done requires it to be done standing up. So, okay. So anyways, you're going to take a deep breath, Feel your lungs completely full. That means expanding that rib cage out all the way. Forcing that diaphragm down all the way. And once your lungs are completely full, you're going to take your mouth and you're going to get your lips and teeth over the ridges of that mouthpiece there. Don't be pushing up against it like this. Get it over it like this and keep your tongue out of the way of that opening. A lot of people will put the tongue underneath this piece right here, okay? I just want you to keep it out of the way. Okay. Once you have the seal on that mouthpiece, without hesitation, you're going to blast out, boom, hard and fast, okay?
Okay.
Now, you are going to concentrate on forcing that air out as fast as you can. That's what you have to do. I'll tell you when to stop blowing, okay? So if you think you're out of breath, that's not reason for you to stop. You just keep going, and I'll tell you when to stop. That's the rule. If you stop before I tell you to, I'll reboot you. Okay?
Oh boy.
All right.
All right.
So we're going to do this 3 times.
Okay.
Hopefully we can get it 3 times. And while you're blowing, I'm going to yell at you. I'm going to say, blow, 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 keep going, go, go, go. Don't get scared when I start yelling at you. Okay? All right. And again, I'll tell you when to stop. So when you take your breath and blow, it should look something like this. So I'm going to do it just with my hands so I don't waste a piece there. And you keep going and going until I say stop.
Okay.
So I'm looking for maximum effort. Okay, ready?
Yep.
Okay. Nice deep breath, deep breath. Blow, 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 blow. Keep going, go, 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 blow, 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 blow. What'd you stop for?
I just continue on.
Are you have to reboot on you?
I have a question.
Yes.
On ours, we have to leave it on and breathe in at the end too.
Okay.
Like